Hello everyone, greeting from Docplexis and very warm welcome to all of you present here. I'm Shifa Sheikh from Docplexis. As we all aware that Docplexis is one of the India's most trusted and digital leading platform dedicated exclusively for doctors, focused on enabling continuous medical education and professional networking. So, dear users, we are excited to inform you that now we have launched our updated version of DocPlexis application, which you can easily download it from Google Play Store and App Store. So you can keep yourself updated with latest notification, important CME sessions, and learning opportunity all at your fingertips. So download the application today for smoother and enhanced learning experience. So today, users, I am delighted to welcome you all for today's another very interesting session in ophthalmology, that is a smartphone-based diabetic retinopathy using offline AI reality. As we must be aware that diabetic retinopathy is a common eye complication of diabetes and a major cause of vision loss and if not detected early. With advance in technology, smartphone-based retinal imaging and offline AI, artificial intelligence are making eye screening faster, simpler, and more accessible. This tool can capture retinal images using a smartphone and analyze them instantly, even without an internet connection. So this can help identify patients at high risk earlier, especially in rural and remote areas where access to eye specialists may be limited. In this session, Dr. Natarajan will discuss how smartphone-based AI is changing diabetic retinopathy with screening is a potential impact on improving eye care. So this very interesting session, it's my privilege to introduce once again our esteemed speaker for today's session, Dr. S. Natarajan. Dr. Professor Natarajan is renowned ophthalmologist and Padma Shri awardee recognized for his lifelong dedication to restoring visions and advancing eye care. With over 36 years of experience, he has performed more than 65,000 exclusive vitreoretinal surgeries and he has also trained over 68 vitreoretinal surgeries globally, contributing significantly to the field. Dr. Natarajan is especially noted for his humanitarian work, including performing over 200 complex surgeries for palate injuries patients in Jammu and Kashmir, where he has also completed remarkable 47 surgeries continuously within 2.5 days. In recognition of his meritorious public service, the government of Jammu and Kashmir honored him with a state award. His dedication to treating ocular trauma victims has widely acknowledged in international publications, including the New York Times. Alongside his clinical excellence, he has maintained a strong commitment to academic and continues to recognize globally for his contribution to the ophthalmology. So we are privileged to have with him today. And so without further delay, I would like to hand over the sessions to Dr. Natarajan. Over to you, sir.
Thank you, Shifa, and thanks to DocPlexus. I'll share my screen. Today's talk is a smartphone-based diabetic retinopathy screening with offline AI, the way to go. So the idea of Diabetes Atlas 10 2021 provides the latest figures on the diabetes worldwide. Approximately 537 million adults 20 to 79 years are living with diabetes, and the total number of people living with diabetes is projected to rise to 643 million by 2030 and 783 million by 2045. 3 in 4 adults with diabetes live in low and middle income groups, and almost 1 in 2 adults living with diabetes are undiagnosed, and more than 1.2 million children and adolescents are living with type 1 diabetes, and 541 million diabetic adults are at risk of developing type 2 diabetes. And diabetes is now the epidemic of 21st century, and diabetic retinopathy is a major cause of blindness in the working middle-aged adult population and fifth cause of blindness globally. The problem, conventionally, retinopathy screening is done by either fundus examination by eye doctors or using conventional fundus camera trained by eye technicians or optometrists. And the primary issue is we have one ophthalmologist per 100,000 population in India. And second, 70% of the Indian population resides in rural area or urban slums. Low awareness or ignorance. And thirdly, follow-ups required for years together, lifelong, for a diabetic patient. And the technical difficulties, unreliable internet coverage, deficit in supply of electricity in many areas, shortage of trained medical staff for operating conventional fundus camera, and also portability of the conventional fundus camera. And these issues can be solved using computer machine learning AI for analysis of retinal images in people with diabetes, thus solving at least some part of the problem, which is being published in 2019 in Indian Journal of Ophthalmology. AI, the way forward. Intelligence is the capacity to analyze, think, make a decision, and categorize. And AI involves formulating a specially made algorithm according to our needs. To develop this capacity and include it in an electronic device like smartphone. And thanks to Remedio, I don't have any financial interest. And the role of the AI is the integration of retinal photography and AI-based reading and diagnosis system for referable diabetic retinopathy. AI performs the following procedure fully automatically, identifies fundus features, classifies image quality, classifies the existence and severity of disease, and all based on deep learning technology. So we have decided that we will work on screening, diagnosing, and treatment. So unity is strength. We need more working hands, and we have to make use of the minimally trained staff already available, and we arm them with AI to bridge this gap. So we made a process flow for the nationwide diabetic retinopathy screening. And in our foundation, we have two foundations, Sundaram Natarajan Blind Free India Foundation and Kamala Sundaram Foundation, where we are doing this daily in the slums of Mumbai and some parts of some villages, where we create pre-camp awareness, assembly of diabetics, capturing of images and uploading, and finally diagnosed by ophthalmologist. So we have an MOU with the Kamala Sundaram foundation. Now it's called, earlier it was called Tejod Foundation for Twinkling Little Eyes. And we have published that. We used semi-skilled health worker. That means select a non-skilled health worker, teach him or her using the AI deployed on a smartphone, non-mydriatic retinal camera in municipal dispensaries in Mumbai. And the computer is trained to accept retina pictures, that is a mobile phone, properly taken by the trained semi-skilled worker, compared with thousands of previously provided diabetic retinopathy pictures, and based on that, notify the staff which patient needs to be referred to an ophthalmologist, labeled as referable diabetic retinopathy. So this is a iPhone attached to an infrared device, and that's why they call it Remedio fundus camera on phone, which can be mounted on a suitable bike for transporting for screening purpose, can be mounted on any table, and it is chargeable. So we also opened eye screening on wheels on 1st March 2014, and this is with another company called Forus, which is they have a camera called Trinetra fundus camera, where my father and my that time a 95-year-old grandmother inaugurated this motorbike with the box which carries the Forus camera. And so I called, you can train anybody, a non-skilled worker, and make them a skilled worker. And I call them, anybody can screen diabetic retinopathy like ABCD. So this shows the various stages of a normal retina, early diabetic retinopathy, moderate diabetic retinopathy, proliferative diabetic retinopathy, and severe proliferative diabetic retinopathy. So in the offline AI, there's an image capture done by the non-specialist. Two, there's an analysis happening, and then sensitivity for detection of retinopathy, referable diabetic retinopathy, contained to remove 100%. So this is capturing the retina photo with a smartphone camera. And you can see this is a video which shows how this camera is used, where the camera has an adapter and which has been and has an app. So the observer can check the retina like this, and then after taking the photograph, they can post this in the AI. There's a media software, and once you post it, it will recognize the color differences and then marks it as blue, and then analyzes referable or non-referable. And all this happens in 10 seconds. And you can see the confidence is 99%. That means the photograph is adequate, and which says it's good. So even the observer who was trained can improve their quality. And here, the comparison between fundus on phone and the one taken with size camera, it's almost comparable. And here we have the lesions where the blue discoloration is a mild non-proliferative diabetic retinopathy. The lower one, the B, which shows a non-proliferative with chronic macular edema, and then the C, which shows the moderate non-proliferative diabetic retinopathy with the CSME. You can see the where there are yellow exudates, which is again covered by blue, which compares with the already saved images. An example lesion detection of by offline in a patient with proliferative diabetic retinopathy with CSME. So this way we arrange the field level screening with a smartphone camera, automated uploading of the images in the from there by the internet to the server, and diagnose and advise regarding further management by the ophthalmologist. And this can act as a link between medically underserved area and tertiary healthcare services. So in 2019, as the AOS ophthalmic president, I started this program Stop Blindness. Currently also an AOS, I am the chairman for the task force for screening diabetic retinopathy screening in India. So screening through teleophthalmology for prevention of diabetic blindness, I call it Jot Se Jot Jalao. And on 26th January, to create awareness, I did a mega diabetic retinopathy screening in Dharavi suburb using 13 fundus on phone devices organized by the Aditya Jyot Foundation for Twinkling Little Eyes in association with Roti Bank. And we diagnosed 649 diabetic patients were screened using fundus on phone, and 53 were diagnosed to have diabetic retinopathy. And we came in the most diabetic eye screenings in 8 hours in Guinness record. And this is what we published: use of offline AI in prediction of diabetic retinopathy using a fundus on phone camera. So we asked a research question: is AI reliable to pick out those in need for seeing an ophthalmologist? So this is the sensitivity and specificity of AI in detecting referable diabetic retinopathy, which was 100% and 88% respectively. So ophthalmologist found 15 patients with referable diabetic retinopathy, and AI also marked these patients as referable case for diabetic retinopathy. So reliability of AI for screening population for DR in need of ophthalmic checkup by an eye doctor is 100%. And we published this in JAMA Ophthalmology in 2019, diagnostic accuracy of community-based diabetic retinopathy screening with an offline AI system on a smartphone. And there's also published in Indian Journal later with more patients. And this is the thing. And also we published with the diabetologist on the diabetic retinopathy awareness and associated multiple comorbidities. And these are the insights from the Diamond study. And the using of AI is a early referral of referable diabetic retinopathy, greater awareness about diabetes, its effects and importance of regular follow-up, greater chat time to referable diabetic retinopathy, timely medical surgical intervention to prevent complete loss of vision, and more job opportunities, more working hands, skill development of less educated. So we can make India free of the burden of diabetic blindness, and teleophthalmology can show the way. And eye care can reach every village via teleophthalmology and artificial intelligence. As I also become the president of Teleophthalmic Society. So AI is likely to be the best or worst thing to happen to humanity. It is up to us which one it's going to be. This is what Stephen Hawking said. We have to use AI as our assistant so that wherever this mundane tasks are there, AI can be used so that it work and can work under an assistant. Thank you very much.
Yes, sir. Thank you so much for your deep explanation on such an important topic, sir. So, can I go ahead and can I ask you questions, sir, based on?
Sure. Yes.
So, doctor, as you explain, like what are the key challenges nowadays clinicians are facing in implementing AI-based retinal screening programs?
In
So,
the clinics, lot people are starting using, but here we are using AI for screening. But in the clinics, I think there's as of now, the fundus camera can take good photographs, and you can store it. But AI can be used because already it is in the clinic where the ophthalmologist and retina specialists are together. So that's not a problem in the clinic. But AI is being used for analyzing the patient's complaint, the OCT, and even the fluorescent angiogram. So those things are softwares are coming where we can analyze images and see more important for treatment, and those sort of things are happening. But for referral, this AI using this mobile model seems to be more practical, easy to carry, and we can carry, and we can no need for a ophthalmologist or a retina specialist to do that.
Okay, that's great, sir. And so the next question is that are there any concerns regarding false positives or false negatives with AI-based screening system?
So fortunately, even with the media not clear, this AI software is really 100% sensitive, and then 88% the sensitivity was there, and so usually false positive is not there. So that's a good thing in this AI what we tried.
That's great, sir. And the next question, sir, what are the regulatory and ethical considerations surrounding AI-based retinal diagnosis?
See, here it's only a referral. So in the regular thing, I think AI, even though you use AI, probably the surgeon or the ophthalmologist is responsible for the diagnosis and treatment. So even if you use AI, finally you have to take the responsibility of accepting the AI diagnosis and treat.
That's great, sir. Thank you so much, sir, for answering all the questions in detail. So let's conclude the sessions on behalf of entire Doplexis team and on behalf of entire our audience. We really thanks Dr. Natarajan for sharing your valuable insights and deep practical experience on such an important topic in ophthalmology nowadays, that is smartphone based diabetic retinopathy using offline AI, the way to go. So your session has truly helped bridge the gap between technology and everyday clinical practice. And we also thanks to all our participants for joining us today for a active engagement throughout the session. And we hope you found this discussion very informative and clinically relevant. So on behalf of Dr. Alexis, we look forward to welcoming you all for today's upcoming educational programs. Till then, have a great day ahead to everyone.
Yeah. Thank you all.